5 things to look for when choosing a healthcare contract. As far as we know, the need to get health insurance now has gone up, particularly since the outbreak of the COVID-19 pandemics. Since news reports came out about the care cost for patients who contracted the coronavirus upon entering the hospital, the overall cost to treat these patients would run up to many lakhs. Further, this action has prompted consumers to purchase a healthcare package, and those who have one previously have already earned premium rises. As a result of the arrival of the coronavirus, the public now had a new choice to choose from to access their public healthcare plans. Even if we are facing a pandemic, upon the option of leaving it to chances, this is definitely not a very sound financial move. Getting healthcare benefits for yourself and your family members would prohibit you from tapping into your current emergency accounts and finances, and therefore hold the long-term savings safe. If you are wanting to change your health cover or choose to marginally improve the benefits of your contract, there are many things to take care of when you buy anew. Knowing your rights will help you determine whether you ever go to the lawyer. 1. Educate the sort of plan you are signed up with. As a misconception, several people seem to believe that only one type of healthcare policies are available in the market. However, many kinds of plans are available based on the specifications of the clients. Some of the programs are indemnity plans, and some of the plans are benefit-based plans. As indemnity policies, insurance providers pay a lump sum fee for costs regardless of the real cost. However, in a defined benefit package, the expense is compensated by the insurance provider instead of the actual expense. These are indemnity benefits, a very cheap option to cover medical costs. Also popularly known as Mediclaim, these are a very inexpensive way to cover medical expenses in case of an unexpected medical expenses. For e.g., in this case, the age group, the insurance cover or amount covered is 9 lakh rupees and the hospital bill is 1.8 lakh rupees. In the one hand, if you have Mediclaim, the whole 9 lakh rupees is reimbursed by the insurer provided the hospitalization is on account of any of the stated diseases protected by the scheme. On the other hand, if you are a policyholder of a serious condition plan and you have to be admitted into the hospital for a specific disease, a total of 1.8 lakh rupees will be reimbursed by the insurer. Understand that individual insurance plans and serious illness plans are very distinct and have different purposes. Although they complement each other, rather they are not complementary, rather they are complementary and their purposes vary. 2. Find out, is the plan has a maximum of 5 subplans. One of the most important aspects of Medicare is the sublimits on recurring payments. The hospital or other potential medical bills may require you to fund some of those hospital procedures from your own wallet. For example, for a 2-bed hospital, the doctor's bills, nursing fees, and operating room costs are split by 2. Also, there is no additional cost of a third party in the room. In most cases, rent for the space for inpatient care is capped at 1% of the gross amount insured by the scheme itself and certain other expenditures. There, instead of an insurer paying a higher part of the hospital for a higher space, the hospital is reimbursed for a lower cost for all costs by the policyholder. Therefore, it is best to adhere to the permitted cap of the room rent or opt for plans that allow no such sublimits. 3. Check to see if people had any pre-existing illnesses. The healthcare business is all about covering unanticipated medical bills. As per their policies, businesses should not protect a lot of illnesses and disorders from the outset of owning the scheme. For e.g., current illnesses are not protected. Any medical condition that the buyer now has is recognized as a pre-existing condition. This will only be compensated after the buyer has been through a specific waiting time. As per the new health insurance regulations, the providers need to offer long-term solutions for people with pre-existing conditions following a waiting period of 48 months. In some cases, some providers in some of their plans may have a lower delay time for contract withdrawals of 24 to 36 months. In this package, the policy will be eligible if the buyer has not withheld any relevant medical records, which will be open to the fact that the buyer has revealed the medical details he or she may have disclosed at the time of buying the health insurance contract. By not filing a claim within 45 days, you face the insurance provider denying your claim. Therefore, it is vital that you take the opportunity to explain all of your medical records while you are signing the paperwork. 4. Find out if there are co-payments, if any. Though it is a common feature, some healthcare policies have a co-pay feature or high co-pay costs or a higher initial annual fee. It basically means, a part of the fee for the hospital service needs to be paid by the patient until the insurance provider covers the balance amount. Federal and state governments usually fund co-payments of 20% of the overall bill cost. One can also choose to go with a higher limit. In the majority of circumstances, deciding to pay for higher limits of co-payments helps in saving on premium. 5. Tell me how many you are trying to cover. We don't have a thumb rule or a calculator to predict how much healthcare coverage we are going to have. Do not base your decision on medical expenses near your home, what you know about the city, or other conditions. It is necessary for a person to keep a high sum cover as medical expenses are on the rise and medical emergencies are extremely volatile. It is critical that at least the family members are protected, as well. And, if you do not have a different health care package from your boss, you can make sure you have one of your own as well. Right now, it is crucial that you have a clear understanding about health insurance. And for that reason, now you have almost full information of health insurance, go ahead and purchase or upgrade your health insurance. You should remember that the contract needs a signature, as well as be vigilant to note everything in the document, as well as all its exclusions.